Good afternoon, ladies and gentlemen. Welcome to the splendid Albert Lecture Theatre, and welcome to the Royal College of Surgeons in Ireland for the launch of the Fulbright Smiling Children Campaign 2022. I am Albert Leung, the Dean of the Faculty of Dentistry at the Royal College of Surgeons in Ireland, and would like to welcome you all here to this event today. This is the landmark Children's Dental Health Awareness event jointly organized by the Fulbright Commission in Ireland alumni and the Faculty of Dentistry of the Royal College of Surgeons in Ireland. We are here today to provide some simple, practical, and evidence-based information on how to create a solid foundation for children's good oral health from when they are born and throughout life. With me this afternoon are two extremely well-known and senior pediatric dentists. We have Professor Jeff Dean, Fulbright Scholar, Honorary Fellow of the Faculty of Dentistry, RCSI, former Executive Director and past President of the American Board of Pediatric Dentistry, Ralph McDonald, Professor of Pediatric Dentistry at the Indiana University School of Dentistry. Jeff is co-author and co-editor of the most read textbook in pediatric dentistry in the world, entitled McDonald and Avery's Dentistry for the Child and Adolescents, published in 7 languages and is its 11th edition. Jeff will be presenting the evidence for us. We're also delighted to have Professor John Walsh, Senior Consultant and Head of Pediatric Dentistry Training Program at Hamad Medical Corporation in Qatar, and a former Dean of the Faculty of Dentistry, RCSI. And together, Jeff and John will be answering some questions, and John will be answering questions, particularly in the Irish context for everybody. So thank you so much, Jeff and John. And to discuss some pertinent aspects of the dental health of children, we will be discussing 1, the first dental visit of a child by the age of 1. 2nd, best brushing habits. 3rd, preventing decay in children with a teeth-friendly diet. 4th, the benefit of fluoride. 5th, preventing dental injuries. And the last but not least, the fact that dental problems in children can be prevented. In the context of Ireland, one of the key fundamental prerequisites in order to deliver quality oral health care, which children and adults in Ireland deserve and demand, is the availability and accessibility of well-trained dental healthcare professionals to serve the public. With the acute shortage of dental workforce, we do urgently need to train more dentists in Ireland, and indeed allow more institutes to train quality dentists in a primary care environment. Let me ask my colleague, Professor Dean, to present some practical aspects of our oral health messages for you. So over to you, Professor Dean. Thank you very much. Thank you.
Good evening, everybody. Thanks for being here. I'm viewing this much more as a public service announcement than a scientific program, but we'll talk a little bit of science. A lot of this is designed for parents and kids to try to help them prevent decay, as was mentioned previously. The Fulbright Smiling Children Project thanks the Fulbright Irish Commission. And I want to thank the Royal College of Surgeons for allowing us to do this here. We're going to take maybe 10 or 15 minutes, probably more like 15, talking about just a few points that parents can do to help their kids end up having happy, smiling children. Early childhood caries is a significant problem. In fact, it's the most chronic disease of children, 4 or 5 times more common than asthma. And so while you might not think that this happens very often amongst kids, it does. And as you can see in the photos on the right, a child that is moderately infected with decay and going down to the bottom where the decay is so badly infected that the upper front teeth on this particular child the crowns are totally gone. There's just nothing left. This quote from Watt in the 2019 Lancet Journal, "The mouth is really a marker of people's social position," really speaks loudly to this problem. In the worst case scenario, cavities can have serious health consequences, and I draw your attention to the slide on the left that shows the abscesses down around this first primary molar, and it can cause something called facial cellulitis that you see in the child on the right, the redness, the swelling, partial eye closure, and truly in the worst case scenario, the eye could be totally closed, or you could even have some airway constriction. So dental decay, besides the fact that it can cause some pain and suffering, miss school, can be a serious health problem too. Fortunately, not very often, but decay happens a lot. Just 2 weeks ago, the Irish Independent had this headline: "Children waiting for up to 10 years for first checkup with the health service executive, school dental service." And Crowley and the Irish Dental Association mentioned that over a third of Irish dentists responded seeing children a great deal of the time with neglected denticians who presented late with a serious dental problem. So this is definitely a problem here in Ireland, and for you parents in the audience, it's something that we have a few tips for you to help as you try to have your kids grow up cavity-free. And we're just going to briefly review these 8 things. Let's go ahead and get started. Probably the biggest thing that you can do is get started with your children coming to see the dentist by the first year of age, which corresponds pretty closely with eruption of the first primary teeth, the first baby teeth, and as much as to check to make sure there's no disease occurring for your child. The dentist will review some habits with you in terms of brushing, caring for the teeth, some early things that you can start doing with your child to prevent them from having decay. I threw the picture in on the left where something called a lap to lap, where the 2 ladies here are doing a dental exam and brushing this infant's teeth. It's an easy way to get in and do some brushing. So the first thing would be to get started early. Why are baby teeth important, you might ask, which happens to me a lot in my practice. Parents wonder, why are we going to all this trouble? Well, of course, for chewing and eating purposes, it's important. There's the aesthetic, pleasing smile. We love having kids laughing and smiling with us. But we want to prevent dental disease and infections of the mouth and face, as I mentioned earlier. But something that many parents don't realize are that the baby teeth guide the permanent teeth into position and help prevent impactions of the permanent teeth. So they're very important for the kids. I want to thank the Dental Health Foundation and others who helped put together this Oral Health in Ireland Handbook for Health Professionals, and I have a few slides in here from that book. We're not going to go through it all, but I just wanted to acknowledge them. Of course, parents, I'm sure you've all heard eat a balanced diet, and this is the food pyramid that's been around for quite a long time, and the main point of this is your child should be eating more of the things at the bottom of the food pyramid and less of the things towards the top. But perhaps just as important is for your child to avoid fermentable carbohydrates and grazing, and I really want to talk a little bit about grazing to make sure you understand this concept. It's frequent snacking and drinking. All too often, our children nowadays are walking around with a sippy cup or chips in their hand, and every time they eat or drink almost anything with carbohydrates in it, they get an acid attack. And what this is trying to show you is the white line across here is when the acid production drops or reaches a certain level, the enamel of the teeth begins to dissolve away. And the more often you do that, the more often you're going to have an acid attack on the teeth. It's estimated that it may take up to 20 minutes for that acid to be flushed away by the saliva. And so if you're eating throughout the day, you could realistically be having an all-day acid attack. And you don't want your child to have that happen because it results in things like this. And this is from that handbook that I mentioned, which I really love. I hadn't seen this before. Children should be fed and put to bed, not put to bed and fed. So don't send your child to bed at night with a bottle with milk or a sippy cup with juice in it because the liquid with the carbohydrates can sit behind the teeth and cause decay like you see in the upper right. Okay, brushing your teeth. Of course, you certainly have heard this. It should be twice a day. The slide on the right is demonstrating that for younger kids, 2 to 3, you should think about applying just a very small amount of toothpaste on the bristles of the brush, about the size of a grain of rice, as maybe you can see down here. And then for the kids over age 2, maybe a half a pea size of toothpaste on the toothbrush. You certainly don't want, even though this is the Halloween season, you don't want to be like this slide over here. I think maybe you can see the cobwebs and the spider on the toothbrushes. I'm ashamed to tell you where that picture came from. I'll tell you privately sometime if you want to know. One of the things parents struggle with is how to check to make sure their kids have brushed their teeth appropriately. The photo on the upper right side is a child that looks like their teeth are nice and clean, and yet there's a lot of plaque accumulation that you can't see. You certainly can use disclosing tablets to stain the plaque, not permanently, just temporarily. And you see on the lower left the pink and red areas where the child needs to focus their brushing on. And then on the lower right is after the child has brushed their teeth. So if you're interested, moms and dads, about a way to check on that, use some disclosing tablets. I do want to hit pretty hard. It's estimated about 70% of decay in permanent teeth in children occur in the pit and fissures of the permanent back teeth, and we have something to prevent that. It's easy to apply. There's no injections. There's no drilling. The tooth is isolated, dried, and treated with this coating that you see on the right. And I just want to draw your attention. This is one of those pits and fissures, and this is a toothbrush bristle. You can see how much bigger that bristle is. Even for kids who are great at brushing their teeth, they can end up getting cavities down in these fissures. And the sealants help prevent that. They're a fantastic preventive treatment. And then finally, I want to talk about dental trauma. I was here in Dublin over the weekend and was able to watch the Leinster and Munster rugby game. It was quite exciting. It's a brutal game, very active. But I was pleased to see many of the rugby players with their mouth guards in. So reinforce this with your children as they're out doing their activities. It's a great picture of a youngster with the helmet riding the bike, and because we can help prevent these types of traumatic injuries to the teeth. All right, so let's wrap it up. I want to talk a little bit about spit or saliva. And if you can read real quickly, I'm not going to do it for you, but the function of saliva is multifactorial. It does a lot of fantastic things for our mouths. And one of them I want to draw your attention to is that it has some antimicrobial action. And this is about all the science I'm going to give you directly, because most of what I've talked about is things that we've been doing for years, maybe decades. Brush your teeth, make sure your child's brushing your teeth, help your child brush your teeth, use fluoridated toothpaste. Sealants have been around for a long time. I put this in here because maybe someday science will help us figure out a way to prevent decay by using something like salivary immunoglobulins. It's a protein that can combat the microbes that produce the acid that cause decay. We're not there yet. We do know that kids at the highest risk for getting decay, and that's about 1 out of 5 kids that are at very high risk, have lower levels of this immunoglobulin in their spit. So if someday, if science figures out a way to bump that salivary immunoglobulin level up, maybe we won't have so many problems. So with that, I want to wish you all happy Halloween. Good luck with brushing your kids' teeth after they eat their candy. And I think we're done.
Thank you very much, Jeff, for a splendid presentation. I would just like to ask if any colleagues in the audience have any comments or questions or anything that you have. Maybe if I ask Professor John Walsh to come in as well to look at things, to answer things in the Irish context, if any. But splendid presentation. Thank you so much, Jeff. Thank you. Thank you. Yeah, got a roving mic in. Anyone?
Dr. Wright, I was hoping you would have at least one question for us.
This is payback for band, right?
Yeah.
Well, since we're messaging to parents, I find one of the biggest challenges, and you addressed this, but if either both of you actually would speak to the challenge of first-year visit, and one of the things we talk about is diet, so that we don't have that cyclical acid attack. What can parents do, and what can we do to help parents change that cycle so they do have they're better aware of healthy foods, but they actually not just aware, because frequently they know it's what they adopt. So how can we push that agenda to really move that? Because I think that's critical in all of this. Not an easy question, but I don't think. But if you got a good, easy solution, I'd love it.
Well, motivational interviewing would be great, but I'm not sure this is a format to discuss the ins and outs of all that. I wish we all had the answer, because we'd be solving most of the problems, and they're still there. I don't have a whole lot more comment other than that.
John, any observations or comments?
Well, I think for the parents present, I think the most important message that we can give them is about stopping the nursing bottle, feeding the child a bottle before the age of 1. And going beyond that age makes decay more or less inevitable in my mind. I also feel that sometimes when children get decay at the age of 4 or 5, that seems to be unexplained. I think if you trace back, you'll find that child was bottle fed or breastfed beyond the age of 1. So I think the single biggest message, most important message, is actually to tell parents, stop bottle feeding before the age of 1. If we do that, I think we're giving them I know that's not an exact answer to your question, but I think that for the parents who are present here this evening, that's the most take-home message.
Thanks.
Something from Professor Mercy?
Something we often hear from parents is, my son is wonderful about brushing, does a great job in the morning and in the evening, and this child's 2 years old. So what do you tell parents about when children should be able to brush all on their own?
So if I could answer that, I told my wife yesterday that there were a few other things I meant to put in there to remind me to make a few other points, and that was one of them. Parents, a rule of thumb is when your child can tie their shoelaces, they have the manual dexterity to tie their shoelaces, maybe they can start doing more of the brushing on their own. But then you've still got the problem that might be at age 8, 9, or 10. Are they motivated to do it? So you've got to follow up, make sure they did it, maybe use the disclosing tablets to find out whether they did a quality job. So that's one of the things I wanted to say, so thanks for asking.
I mean, in the context in Ireland and around your experience in John?
Well, my own experience would mirror Jeff's, that children just don't have the manual dexterity to do it themselves. And sometimes some children don't acquire that manual dexterity at all. But in reality, I think it's important that we give parents the message that they continue to brush their child's teeth until they're well able to do it. In an Irish context, one of the biggest problems that we face is the size of the toothbrush that parents buy. Most Irish parents will tend to think that they buy toothbrushes by the yard rather than by the actual size. And if we could get the message across that the width of the toothbrush shouldn't be any wider than the 4 lower front teeth, then they're able to get into all the little nooks and crannies. So sometimes smaller is better. And as Jeff said, the single most important thing is to make sure to use the correct amount of fluoride toothpaste at the correct concentration as well. Because some children's toothpaste that are specifically produced for children have a lower fluoride concentration, and it's been shown to be completely ineffective. So it's better to use the toothpaste that you use yourselves, but use the correct amount. Grain, as Jeff said, a grain size piece for those children between 0 to 2, 0 to 3, and then increasing gradually in size to a pea-sized amount, and then finally ending up with the regular amount that you would use for yourself.
There's a question to the back there for...
Just a humorous aside to that. There was a message that I saw recently that a parent said their child said they heard a message that brushing alone is not enough to stop caries. So he had gotten his mother and father to brush their teeth along with him, and they weren't quite sure when to tell him that that wasn't what the message was saying.
Yeah, just there's one at the front. Yeah, can you pass the mic on to? Yeah, thank you.
This may be a timely seasonal question, but we get this a lot this time of year, and it's Halloween. And in the U.S., kids get an awful lot of candy. Not sure if it happens here also in Ireland, but they probably get treats along with the holiday, and even with Christmas and other things that are coming up. How do you tell a parent? What do you tell a parent this time of year if there may be excessive sugar and treats around?
John, what do you think?
Well, in Ireland, the annual consumption of sugar per person is about 116 pounds per person per year. So I wouldn't for a minute suggest that we were any better than the United States in the amount of candy or sweets. And children in Ireland seem to be able to source sweets, biscuits, soft drinks in every location. So from the point of view of it's much better, as you know, that it's better to eat them all at the one time, at meal time, and that reduces the actual length of the acid attack, and also to make sure to brush before and maybe afterwards as well with the fluoride toothpaste. And we're humans as well as pediatric dentists. We know that children are going to do this, so we try to minimize the damage as much as possible. But it's a real challenge.
I think very often we see that in clinical practice and others, we say parents coming in and say, "Oh, do we need to have the child to see the dentist at age of 1? What about 2, 3, or 4? We haven't noticed any problem with little Johnny's teeth." So would that be good advice, or would that not be, Jeff?
Well, that speaks a little bit to risk assessment, which I briefly touched, saying 1 out of 5 kids roughly are at higher risk for decay. And it's difficult at times to figure out which are those kids that are at the high risk. It is good to stratify the higher risk kids and have them in for more frequent visits, but even the kids that don't have decay as a 2 or 3-year-old still can develop the decay later. Sealants on permanent molar teeth are typically done maybe around age 7 or 8. And so the dentist needs to follow the children throughout childhood to make sure that all the things during the appropriate times are being done, and to give suggestions and guidance to the parents.
Thank you. And John,
Well, the message that Jeff gave earlier about the first dental visit, to establish a dental home with your dentist or pediatric dentist before the age of 1, I think is the vital message. In Ireland, we have a big problem in that respect, and as he highlighted, there are many children in this country who don't see a dentist for the first time until 7, 8, 9, and sometimes even beyond that, and that's actually a disgrace. And that's something that we hope that during this week we will be able to highlight to the public, both here and in the media over the next few days, that we want to see a situation where children's first dental visit in Ireland is before age 1. It's much easier to prevent something than to actually cure it. So if we can give that information, then we will have achieved something that's really special.
Thank you very much, John. Thank you. Michael, sorry, you've got one. Yeah.
Jeff, you showed a case there of trauma to the anterior teeth. And I think one of the problems we see is that the expense of making gum shields on a regular basis as their teeth keep on changing. just ask the both of you what you feel about the bite in the bag, if you like, the heated ones that people wear, the gumshoes the kids wear.
I didn't quite hear that question.
That's about the use of.
Do you want to-
Okay. Having played rugby myself poorly and having suffered trauma frequently, I am absolutely convinced that a really good fitting mouthguard is necessary. If you think about the actual cost of a mouthguard, a properly made mouthguard, and you compare that with what it costs to get repairs done to teeth that have been traumatized, it's very easy to come to the conclusion that a mouthguard represents really good value. What do I think of stock mouthguards and boil and bite? Not a lot. I think that sometimes we're forced to do it, say, for orthodontic patients where, stock mouthguards can be of benefit. But I really feel strongly that a custom-made mouthguard is absolutely crucial. And the message that we give to parents is that, not only will it protect your teeth, but it can also protect your child's life, because it can mitigate against the effects of concussion, which is a really important thing nowadays for anybody who plays a contact sport. And as regards what sports, personally, I think all sports, basketball, rugby, soccer, you name it, horse riding, it should be mandatory for those sports. And I think a campaign like that in Ireland would make a significant difference and would cut down on the expense that the government has to spend. And in fact, it could be consideration given to maybe subsidising the cost of mouthguards for children on an annual basis.
Thank you very much, Sean. Thank you, Jeff. Any comments on?
No.
Thank you. Yeah. Any other questions? Any other comments, colleagues? Okay. Let me just say thank you so much for everyone for your time, your attendance, and I also have one major aspect of colleagues to thank, which is the Dental Health Foundation Ireland, who has given us a lot of literature, information, basic information, particularly if you are in Ireland, to collect the information for parents, to educate the parents, to educate the kids, and also so that we can start early from the age of 0. And I have been reliably informed that the leaflet and the information provided is also in Romanian, Ukrainian, and Irish as well. So it's been very, very useful for everybody. So without further ado, what I was asked is we would like to invite all of you to go over to the atrium on your right, and there is a little reception of a couple of nibbles and drinks there to see all of you. And just like to say thank you very much for coming, and I'm very, very grateful to Jeff and to John and to all my colleagues and everyone, to Red Box and everybody for your attendance and for planning this event. Thank you very much indeed. Thank you. Thank you. Thank you very much. Thank you.